On behalf of the Canadian Foundation for Pharmacy Board of Directors, welcome to our third Pharmacy Forum in 2022. My name is Paul Kitston, and I am the Executive Director for the Canadian Foundation for Pharmacy. Rui Su will be providing us insights about digital health in pharmacy, and our panelists consisting of professional pharmacists will provide their perspectives and commentary. But first, let me take a few minutes to let you know a little bit about the Canadian Foundation for Pharmacy. People ask me, what does the Canadian Foundation for Pharmacy do? First of all, we're the only nationally registered Canadian charity for pharmacy. We are the hosts, of course, of Accelerating the Pace of Change, which is the CFP Pharmacy Forums 2022. We support leadership, pharmacy leadership initiatives through our Wellspring Leadership Grants. This year, we have provided over $18,000 in grants to 3 pharmacy leaders. In addition to leadership grant funding, we also support innovation research grants in pharmacy. This year, we've provided 4 research teams over $111,000 in research grants to improve patient care through community pharmacist innovation research. On November 7th, 2022, we hosted the Pillar of Pharmacy Award Dinner, which is a premier Canadian recognition award event for top leaders in Canadian pharmacy. These are just a few of our initiatives. Please check out our website to see all the things that we offer. So we believe community pharmacists play a vital role in Canada's ever-changing healthcare system by financially supporting pharmacy innovation research, leadership education, and recognizing the leaders who make it happen. We can play an important role in improving patient care in Canada. We connect sponsors and great pharmacy leaders who are on the forefront of innovation. Without their support, we just simply couldn't do what we do. So thank you. Donors and sponsors are making a difference in the quality of healthcare across Canada, and today's Pharmacy Forum is an example of their generous support. Special thank you to our Peer Healthcare Solutions, Inc. for their work in helping Rui Su in digitizing this CE program and offering it free of charge for the next 12 months. Without further ado, I would like to introduce our speaker and panelists. Rui Su is the co-founder of MedMe Health, a digital pharmacy care platform that experienced explosive growth during the COVID-19 pandemic. Rui is also co-author of an accredited program on digital health and pharmacy practice, just launched in Canada and funded by a grant from CFP's Wellspring Pharmacy Leadership Awards. The focus of our talk today. Aska Patel is a pharmacist and entrepreneur with a passion for the digital delivery of health and pharmaceutical care. Founder of Acuvise Consultancy, Inc., Aska and her team provides healthcare, startup, and environmental sustainability consulting. In her podcast, Diverse Conversations, Aska discusses the future of pharmacy, health, and health technology with global industry leaders. Ashwa Junga has a doctorate in pharmacy and a master's in business administration. He has spent his career pushing for deeper pharmacist involvement in patient care and has helped champion innovative approaches within pharmacy through various panels, presentations, and published articles on innovative approaches and technologies, including pharmacogenics. He is currently clinical affairs lead at Enagene Diagnostics, Inc. Gurpreet Lal was an associate with Shoppers Drug Mart for 10 years until 2014, then started his independent pharmacy journey. At present, he owns 2 pharmacies in Brampton. Gurpreet always had an interest in technology and for years has been dismayed and frustrated with the lack of technology in pharmacy. Together with some partners, he has launched innovative websites that helps expand technology in pharmacy. I will now pass this over to Rui Su, our presenter.
Perfect. Alrighty, so hello for everyone on the recording. My name is Rui, and we'll be going through kind of the why of why we partook on the creation of the digital health in pharmacy CE. All right, so for the audience joining us live, as well as for those at home looking at this post, I think I just want to take all of us back, to the early 2020, when it was a time of great uncertainty for our profession, where we really had a number of different challenges in having to change operations and having to figure out new ways of care delivery in a truly unprecedented time. And in 2020, I was in the early stages of building my company, and I spent a lot of time really just talking to pharmacists, hundreds of pharmacists, on the pain points that they were experiencing, the uncertainties, and what they wanted support with in their practice. And there were consistent themes of systemic barriers to adoption of new technologies, barriers to the adoption of virtual care. But in addition to that, we also got many questions on how to really operationalize a new model of practice, a virtual health practice. There was also, we discovered a lack in familiarity with the rapidly changing digital health landscape and the different types of technological advancements that were coming out into the landscape. And in my day job, I was also witnessing really a very growing acceleration of innovation with massive investments in health tech in the United States. And with these two put hand in hand together, I really realized that there needed to be a more comprehensive and pharmacist-focused resource to provide everyone a starting overview and a level playing ground for everything that was happening within the digital landscape, and something that was actually tangibly applicable to the practice of community pharmacists. And that's really the why as to why we started to work on this. And just, in terms of the landscape, we really saw that acceleration in digital health adoption from providers and patients. We saw changes in the regulatory and reimbursement environment with regards to virtual care. We saw the adoption of new technologies, especially when it came to virtual visits with physicians, which increased 15-fold within that year compared to pre-pandemic times. But we also saw this interest and engagement from patients in data and surveys that were conducted that, for example, in May of 2020, almost half of all those surveyed have accessed advice using phone, email, video conference, and text methods with really solid satisfaction levels. So we really saw a change in behavior of individuals and how they interact and what they expect to interact when it came to healthcare with different providers. In the explosion of this change over the last 2 years as well, we've also seen that we are in a fourth industrial revolution across different business sectors. And this has been marked by exponential technological advancements in AI or big data, robotics, you name it, across a number of different industries. But we have also entered an era of digital health where in many different fields, the use of these technologies, whether it's analytics or AI and information communications technology, is now pervasive among citizens who now demand responsive, digitally enabled healthcare services. And especially in a time now when you're going to the bank, when you're going to go to a restaurant, these digitally enabled experiences are also pervasive. It is here in healthcare, and this is something that within pharmacy is a challenge for us to take on as well, and see how pharmacy as a profession we're going to change in this era of digital health. From another perspective, from the startup perspective as well, there has also been a number of new entrants and huge investment into the space. And so there, as you all may have seen, there's proliferation of online pharmacies where they've received billions of dollars. For example, Hims and Hers is a company that went public at a valuation of $1.6 billion in the United States. And that's almost the same valuation as Rite Aid with their 2,500 physical stores. And just purely because and due to the huge venture capital funding, a lot of these companies' business models are looking to either displace brick and mortar pharmacies and doing so at a loss to gain market share. And we can see from this infographic created by Dr. Timothy Unks, there's also a number of different startup companies in virtual care, virtual pharmacy, digital therapeutics, personalized pharmacy services, direct to consumer prescribing, and chronic disease management that are really disrupting what we have known as pharmacy practice to now. And when we look at these interviews and these conversations that we're having with pharmacists, we also see consistent themes of systemic barriers that prevent pharmacists, especially community pharmacists, from being able to adopt new technologies and make this change. A very, very big topic that consistently comes up is slow and uncertain government governance. And so legislation is often lagging, delayed, and unclear on specific implementation criteria. And even when they do come out, they tend to be more prohibitive instead of actually providing a strong and enabling framework to ensure the successful implementation of new initiatives. And this causes pharmacists, especially in the busyness of their days and needing to look at what to invest in, hesitant to actually invest in the training and the technology required because we don't know the longevity of the legislations. We don't know the longevity of the reimbursements, especially as we saw within Canada, virtual care pharmacy services, we really didn't know how long they were going to last for. So why should we invest in some sort of location independent virtual care practice when that was the case? And this leads into, just as general human beings, we do have a preference for the traditional, unless there are significant, qualitative and quantitative gains for a completely different option. And we saw that although there was this change for virtual care in the medical space, there was still the tendency for pharmacy to remain with our traditional method, which is the phone. And this is this comes into play with just the high amount of inertia that it takes to implement any new system and invest in that in a long-term basis. Of course, we have to note that despite the growing number of older adults embracing technology, technology's use amongst old adults still has barriers with factors like low digital literacy or non-accessible software design, or just fundamentally individual vision or hearing changes. There remain challenges for this population segment who would maybe prefer to jump on the phone to talk about their health and healthcare. And the last and the biggest barrier of all that consistently comes up is the lack of interoperability between systems. And this is the biggest pain point, which hinders innovation. It hinders adoption of new workflows for us to be able to implement this into pharmacy practice. And fundamentally, it's the pharmacy management systems that exist and being able to integrate, often disparate digital pharmacy tools. And we are at a nascent stage where there are many pharmacy innovators creating these awesome tools, but if they can't be integrated or interoperable with the systems that we are using, it's very, very difficult for massive change at scale to happen within our profession. And so now we are at a crossroads here. We're at 2022 where we are seeing consistent scope of practice increase, especially over the last decade within pharmacy. We see minor ailments coming out, reimbursement, new legislations coming out, point of care testing to be enabled to be done. But if we do expect, in this future, continued growth of our scope of practice with new legislation and reimbursement, how will we as a profession really sustain the operationalization and scalable adoption of these services on top of our current responsibilities. Coming out of this pandemic, we know that pharmacist burnout and attrition is at an all-time high. And so how can we expect the same output and outcomes when we're still using the old tools and solutions? And so given this challenge that we are in right now as a profession, and also the market pressures from different entrants in the industry who are funded by millions and billions of dollars, how can we within community pharmacy here in Canada explore some alternative and creative solutions? Perhaps that means looking at leaning into emerging opportunities within digital health applications in pharmacy, with an ultimate goal to push for that greater systemic change and innovation to really move forward in our professional identity and direction. And so I propose also within the CE that really when we are looking at such a systematic and ingrained status quo, and it seems really impossible for each of us as individual pharmacists to penetrate through, government legislation, reimbursement, et cetera, what can we do then on our day-to-day as a group in order to push forward for that change? And the first is really why we created the CE, in order to create additional training and resources to enable that knowledge dissemination and training in this area, with focuses on the practical, high impact, enabling frameworks for adoption within community pharmacy, but also through forums like this one, being able to further discourse on those larger systems level issues and opportunities that we see across Canada. Secondly, I think it's really important that we have participation and engagements from pharmacists in the design, creation, implementation, and evaluation of pharmacy-specific digital tools, because we know, given the wealth and diversity of patients that we serve in different communities, that one size fits all rarely works in pharmacy, that local context is key. And that's why we do need this engagement to continuously iterate on solutions, have that real-time feedback, and have that appraisal in these tools as they become introduced and integrated into practice. And lastly, what's really, really important is for us to have our eyes on that long-term future when it comes to opportunities that arises from the leveraging of digital tools, especially when it comes to data, because now data is able to be much more scalably collected and analyzed with the shift to digital. And so, for instance, getting sufficient data to help drive decision making and advocacy has always been a challenge when interventions and services are documented ad hoc or on paper. But now, if data can be generated across all points of across a patient's care journey and with the pharmacist intervention, how can we plan on how we're going to best track, aggregate, and use these metrics to inform pharmacy practice research and really truly advocate for that increased reimbursement for pharmacist-led clinical services? And that's, with that kind of theme in mind, that's really what went into the creation of this 5-module course. We have a total runtime of 1.5 hours, and they can be broken and seen in chunks. I'd like to quickly walk you all through, what we cover. So if you're interested, you can sign up, and it's all free, as has been created and produced with support from the foundation. And so in module 1, we provide really an introduction into the current landscape of digital health and virtual care. We identify some enablers of digital health so far across different domains, and also explore virtual care in Canada from the perspectives of medicine and pharmacy. In module 2, it's really an introduction to digital health and all the different categories and how we actually really define digital health in the different areas that come through. We also provide a summary of that evolution of digital health from the past into the future. And we do highlight some of the examples of early adopters, especially in pharmacy, and how they have been able to successfully implement different programs and strategies to incorporate this into their practice. In Module 3, this is really where we get into the thick of virtual care. This is probably the most talked about term that we've seen over the last 2 years. So we really wanted to break it down, define virtual care, but also differentiate between some of the different terms that we consistently hear being thrown around, whether it's digital health, telehealth, telemedicine, telepharmacy, and how that all interplays together within the greater ecosystem. We also go and explore pharmacy virtual care in action, and we highlight different domains from telepharmacy, internet pharmacies, remote dispensing, virtual pharmacy consultations, virtual observed therapy, remote patient monitoring, which has been a huge topic that has been growing over the last few years, as well as talking about virtual pharmacy clinics. And in Module 4, we really get down into the practicalities and describe how do we actually think about implementing virtual care in practice, and where are the different areas that within community pharmacy it can actually start to be implemented. We use a case study model that we're familiar with in our clinical cases to really list out the different patient considerations when executing virtual care. And then we also provide frameworks to help community pharmacists evaluate digital tools before incorporating them into practice. And lastly, with Module 5, we dive more into a future state and thinking about the opportunities and risks within pharmacy innovation at present, some of which we've talked about today, the core barriers to adoption and innovation. And we also review applications of digital health within an international context to see what other countries have really done within their change within pharmacy. We also postulate the future directions for pharmacy services to be supported by technology. And I would love for those of you who are joining us to also share any ideas that come into mind and bring this into a discussion as you go through the modules. And last but not least, our course. I'm very, very excited to announce that our course is now live for free on the website here. And if you have any questions, comments, or feedback, please drop me a line. My contact information is shared there. And I'm also just really interested and excited to dive into the discussion with our amazing panelists and moderator as well. So Paul, without further ado, I'll pass the baton over to you.
Okay, and I'll pass this on to Aska.
Thank you. Thank you, Rui. That was a great session to start us up, I think, in this panel discussion and conversation. But I also wish to open this opportunity to our audience who's joining us. Please feel free to type in your questions into our Q&A box or into the chat box, as we are having these discussions, and we'll be sure to make sure that we get our thoughts from our panelists as well before we let them go for the session. So without further ado, I think you hit on some really great points when it comes to the digital healthcare landscape, especially here in Canada. And obviously, for all of you as panelists, I know you're doing some really innovative work in terms of trying to challenge the status quo and trying to move the needle into the future where we're more technologically integrated. So I guess my first question to you as a group, and I'll start with you, Rui. I guess when you were launching your innovation, what was one of the biggest barriers to adoption of that technology?
I mean, I really talked about, those 4 key barriers that we kept hearing time and time again from pharmacists. And I think in the beginning, back in 2020, that preference for those traditional methods really came through. This is what we are familiar with. This is what had been working for such a long time. And it didn't require, additional training or investment in those technologies. And so that was really what came through in the beginning stages. But I think as we have all seen, there has been a great shift in the adoption of technologies we see pharmacists investing in search engine optimization and being able to drive ads to their different pages that really increased the number of services that patients were adopting. They were able to use, digital tools to improve their digital presence, and as a result, we're able to gain new business as a result of that. And so now when we're talking to our clients and prospective clients, what we're really seeing is that interoperability and that lack of interoperability. And it's difficult to innovate, I think, when you're not given whole access to being able to allow for that stream of patient interactions and all of those interventions to be in one place. And there are government barriers and government barriers that have placed restrictions on what pharmacists can use when it comes to technology as well that have come in, but really it's that greater system technological barrier that's been kind of hard to breach.
Awesome. Thank you, Rui. And I guess I'll move over to Gurpreet. Your thoughts on this question?
Yeah, I mean, thank you for having me, first of all, on this great session. Look, just like Rui was saying, when we tend to get siloed in pharmacy, depending on which side of the counter we're on, right? When you're a pharmacist, in spite of your grand ambitions of, healing everybody and fixing the world and, bringing the latest technologies and the latest treatments to everybody, as soon as you get into the pharmacy as a pharmacist, you start being a pharmacist, you take care of your patients. And then and on the patient side also, they may have hopes and dreams and desires of getting the best healthcare that they want. But to Ree's point, it's the barriers, right? It's what stops us getting moving forward. And I think on a pharmacist perspective, the biggest challenges we had, governance, I think, is a challenge. I think it's a limitation, and it's a big barrier to us moving forward. But I also think that governance is a universal challenge. And so I don't think that we should allow ourselves to get bogged down because of that. Because the problems that we face with governance and legislation in Ontario and then across Canada and perhaps across the world, they're universal, as I said. I think the biggest challenge that we have had in kind of rolling out our technologies and what's available, what we offer to our clients, our patients, and our pharmacies is essentially this overwhelming desire to do the best for the patient without changing anything, right? They know how to do everything. Pharmacists know how to do everything, and pharmacy owners know how to do everything. But they're very, very, very hesitant to just move from where they are right now, move forward a little bit. And I think a great example of that is, and I've said to Ashwin a few times, I think a great example is, some people still don't have Apple Pay on their phones, and yet they slip their credit cards, into their phone, into the sleeves or into the phone protectors. And I find it quite absurd that, you have great technology at your disposal, but you kind of get siloed into just thinking the only way that I can take care of this patient is by making sure that their medicine is ready on time. And that's it, and nothing else. That's number one. And then the other issue is taking ownership, right? As pharmacists, we're too scared to take ownership, right? Or certainly in my experience, I could be, speaking to a group of pharmacists and professionals here who take ownership of everything. But where I think we're too scared to take ownership of even the smallest things, we've for years been able to adapt prescriptions, renew prescriptions, all these kind of things. And yet, we still go back to the doctor and say, Doc, listen, I think this is probably better if I do this. And the doctor's like, sure, do it. But we, I think, are really stopping ourselves from moving forward. Now, as we speak to individuals, as we speak to people in this panel, we're all motivated here. So we're all thinking, yes, absolutely, all shaking our heads nicely. But as we individually, we have ideas of how we're going to move forward. As a group, we start falling apart, because unity in this profession, unity in kind of which direction we're going to go forward, that I think is lacking. So for me, governance is not a problem, and it is a problem, but we need to come together and move forward in the right way as a group. And these kind of panels, these kind of meetings, I think that's really what's going to help us move forward a bit.
Thank you, Gurpreet. Couldn't agree more with you on those thoughts you shared. Thank you very much. And Ashwin, I'd love to hear your thoughts on this as well.
Yeah, absolutely. Thank you for that. So yeah, no, and I think what Rui mentioned were really important barriers in terms of adoption. Those are all somewhat external towards what we can actually do, you know, in our own pharmacies. And I think one of the biggest things is the fact that, you know, with a lot of the changes that have occurred over the last couple of years, they've been as a result of a black swan event, the catalyst being COVID-19. Oh my God, we need to vaccinate the entire population. And what we need solutions. We need you know, patient relationship management systems, schedulers, and things like that. And so as that sort of dies down, I think now there's a bit of a fork in the road where we don't have that catalyst or black swan. Maybe there's another black swan event that's about to happen, but now we have all these directions we can go in, and I think they're sort of contingent to what the market, the pharmacy operates in. So maybe you need to do more chronic disease management, diabetes. Maybe you need to do travel health. Maybe you expect to see a huge surge in ambulatory or minor ailments as legislation comes through across the country. And so how are we, like, do we have a strong enough catalyst then to allow us to follow through on adoption of these new technologies? And I think that, you know, I don't have an easy solution to that, but that's, I think, a big question we have to ask ourselves, because there's a lot of optionality built into what we want to do on a micro scale. And then how does that then push the technological agenda forward? And I even think about sort of the way we operate traditionally, and that is, we just put up a sign that says pharmacy, and then people come to us. We're not used to saying, hey, come see us. We can help you. These are the solutions we provide. The solution traditionally, at least in sort of a more of a much narrower view, is that the solution is this prescription that I've been given, and I'm bringing it to you, and we fulfill it. So I think that it kind of goes in part and parcel with that aspect, and I think a lot of that is going to need to be addressed at a sort of a, you know, with engagement of a lot of stakeholders, a lot of psychological, behavioral approaches, professional development. But I think that really stands out to me as maybe as a complement to some of the barriers that Rui has mentioned.
Thank you, Ashwin. And it's amazing how all the barriers you have identified, all three of you. We are actually having questions from the audience come in, you know, similarly in terms of asking further questions around those barriers. And I think what we'll be kind of dealing with first is around the regulatory framework, because I guess as regulated healthcare professionals, that's always something that, you know, we're very mindful of, and we want to make sure that we are functioning within the scope of practice that we have been assigned. But at the same time, there are some great questions here, and I'll try to clump them together. One of the questions is, you know, what is the current regulatory process with the massive growth that we have been seeing with the digital health apps and technology and home digital tests? You know, what is the current process for that, and how will a pharmacist know which apps or home tests are reliable, or, you know, they are safe and effective, I guess backed by evidence to kind of support recommending them to their patients? And any of you can start at this point.
I can start. Thank you, Lindsay, for the question. And honestly, the answer is that there is a lack of process as it happens now. And most recently, I learned about a test for that could concurrently test for COVID and flu that was passed through Health Canada, that was made from an American company, that was passed through Canada, and able for us to be able to use it, but they weren't even passed through in the United States yet, and there was like no acknowledgement, no process of us being able to learn about it, being able to learn about how it was made, being able to learn about why it was validated, and how we could implement it in our practice. When it comes to the recent legislation enabling point of care testing, for instance, that outside of COVID testing that we're doing in community pharmacies, we really don't know too much about it. There's not guidance or literature, and the fact of the matter is there's the evaluation piece, and being able to be aware of when things come to market, but then there's the implementation piece. How is this going to be seen by patients? Is this something that they are hearing from some other way and coming to the pharmacy about it? Because that's really, Ash, when we talk about catalyst, that's really one catalyst. When you have, so many patients calling the pharmacy about a specific ask, that's been the fuel to being able to implement some sort of digital tool to kind of manage that demand and be able to implement that clinical service. And so that implementation, operationalization, am I going to get demand for this? Am I going to get enough interest? What's payment going to look like? All of that is kind of lacking. It's not just, oh, something is approved, because there's so many different steps to actually implementing that successfully within the community pharmacy landscape.
Thank you, Rui. Gurpreet, did you have?
Yeah, I mean, I'm just on the side here. I'm just making a bunch of notes because I think the discussion that we're having this is just the starting of a larger discussion, of course, and I hope this carries on. I just want to touch base on a couple of points. I think if we get bogged down on regulation and governance and what I can do versus what I can't do, we're just never going to move forward, right? And this is coming back to the point that I was making about us taking ownership, right? None of us are asking each other to do anything which is incorrect. Absolutely not. And we must abide by all the rules and regulations that we're bound to as professionals. But a great example, for example, is of minor ailments and even COVID vaccinations. Now, I know a lot of pharmacists who just didn't do COVID vaccinations, right? They chose not to, a myriad of reasons, and that's fine. But I think this is we ask ourselves, Ashwin said, what's the next catalyst? COVID-19 made us change a lot of things. And to throw some humor into the discussion, it was like Ross going up the stairs in Friends, pivot, right? Some of us did, and some of us didn't. And we just hoped that it would just at some point be over, right? But when we did pivot, we discovered that, look, we actually can be our own catalysts, right? So if, for example, now minor illness is coming up, right? So let's talk about the future. Minor illness is coming up. Look, you may not have had any appointments in your pharmacies before, and it worked fine for you, right? It's okay. You didn't do COVID vaccinations, you didn't do anything, and that's okay. But be your own catalyst, right? So there is so much technology available out there. We're providing technology, other companies providing technology without naming names, but use what's at your disposal, right? For everything, right? Minor ailments is a great example, but you can also just use them for simple consultations that you choose to have with a patient. If you know a patient is going to have a really long consultation about anything, use the appointment app available to you. Engage your patient that way. And as soon as you start engaging a patient or anybody with one piece of technology, you then think to yourself, I can extrapolate. I can use other things to bring them in. So we spend our money. We complain about how much our techs are costing us and our pharmacists are costing us, and rent is going up and so on and so forth. And then insurance companies are bringing the prices down. So I'm still an owner of pharmacy, so I deal with this on a daily basis. And I've been dealing with it for 20 years, and for 20 years I've always had a cash flow problem, right? But I can fix those problems. I can't go back to governance. I can't go back to legislation. I cannot go back to insurance companies and say, give me more. I can't go to ODB and say, give me more. What I can do is utilize all the technology that's available to me, as archaic as it was in the early 2000s, as advanced as it is right now, and be part of the solution. So if we all say, I know this technology is available, let me spend my money in the right place. I don't mind paying 20, 30, $100 a month to get this technology in place, because look at the reward I'm going to get at the end of it all, right? So move away from counting the pills, be the pharmacist, take care of the patient, bring our technicians into where they should be and do the technical tasks, but enable it, make it smooth. If you're going to be just sitting in the pharmacy waiting for somebody to come, right? Our PMSs, our Crowds and Filwers of the world, they don't do that. All they do is help the insurance companies pay us, right? Sometimes, in fact, most often, not what we think we want, right? We need to basically take all this available to us, right? Learn as much as we can about technology, bring it into our stores, drive our services to our patients, and put ourselves back in the front. Because frankly, and 80%, 90% of my patients come to me and say, I need to know what to do, Gurpreet. I've got this problem. The clinic is right next door, but should I go, right? And most often I'm like, no, you're okay. I can take you right now. But if that was an appointment, if that was a formal service, I'm there for the patient, and then I can then change that into a minor ailment prescription, and I can get the prescription, and then I can do referral to the doctor, and hopefully with the data that we collect, we speak about data, right? I cannot go to anybody and say, listen, I affected 10,000 lives or 20,000 lives without actually having those appointments in place, without having the outcome of the appointments in place, without doing, how many referrals did I actually make to a doctor this week, this month, this year, right? If I made 10,000 referrals based upon my scheduling software, I can go to anybody and say, guys, there's 30 pharmacies here, 100 pharmacies here, 10,000 referrals, 20,000 referrals, give us money, right? And so this is what is most exciting about these things. It's not what we cannot do or what's stopping us. It's what are we ready to start to do, and with who?
Right. Agreed. Thank you, Gurpreet. Those were some very, I guess, very useful insights, because I agree with you. I think innovation always usually happens outside of the norm, right? You're trying to change something, and that's where innovation, that's where you need to innovate, is, doing something that we're not currently doing. And sometimes we do not have the necessary evidence or, the framework that we would require to have the adoption. And Ashwin, as I come to you, I guess I want to add a layer to this question, because again, it's one of the audience questions. How can we, make sure we have the regulatory framework? And this is coming from Rita. How can we advocate for regulations to allow for interoperability, allow for innovation? Because the themes that I'm picking up from the discussion so far is, we don't have enough data to support what we do. We are not able to communicate with each other, like data sharing is not happening. Is any insights on that that you'd like to share?
Yeah, absolutely. Ultimately, I think a lot of it goes down to first principles and what we're trying to do. We're trying to help people. Even if you look at the Canada Health Act, which is sort of the cornerstone of healthcare, which is accessibility and portability of healthcare. Well, what are our solutions trying to do? They're trying to actually further these missions, trying to help patients improve their health. And so I think if our argument to support innovation, technological innovation, falls in line with these first principles, I think it's just a matter of time between these things actually come into effect. There's always going to be a lag between innovation and regulation, because innovation, not to go ahead and suggest I'm an unabashed capitalist, but innovation often comes from the machinations, what is the ultimate basis of capitalism, which is oftentimes these innovations creating solutions for problems that exist because people are chasing the dollar, right? And this always works quicker than regulation. So, we're always going to see these solutions before the regulation catches up. But I think that as long as we're in compliance and we're supporting these sort of central tenets of both our federal healthcare system and how it's administered by the provinces, I think it's just a matter of time before it comes about. I don't think we're going to get pushback when we're saying that we're increasing accessibility to care for Canadians and we're improving outcomes and we're using this technology in a diligent, safe, and responsible way. Who's going to say no to that?
Agreed. And I think that's also another piece that I see as a not necessarily barrier, but a challenge we need to overcome, as Gurpreet rightly mentioned, together as a profession is, kind of navigate what is our North Star that we want to go towards or move towards as a profession. I think that will also help us in terms of advocating for, what is the scope, what are the tools we need to practice that scope and reach that destination that, we identified as a profession together, that this is where we need to go. Thank you so much for sharing that. And I think, Rui, I'm going to come back to you because there is a question about interoperability, and you had mentioned about interoperability being a barrier to digital health. And there's a question from Nick. He mentions during the Health Canada InfoWay conference, a couple of days ago, interoperability was discussed and its latest implementation of Prescribe It with one of the big chains. Is there a misalignment in terms of how interoperability is being approached as a whole, and your thoughts on that?
Yeah, thank you so much for the question. And I would love to hear if any of the panelists could maybe share a little bit more about those discussions at the conference. But from kind of how we see it, there's kind of two elements to this. One is having similar standards. And so when we talk about EMRs, like Epic, for instance, there have already been standards that have put in place on how to best structure the development of technology that allows for interoperability with other systems. And we're talking about the FHIR standard that has been used across medicine for many, many years. And how do we then bring in this similar standard when it comes to pharmacy technologies, so that it's not just one disparate technology or tool coming up and another that don't speak to each other, that lends itself to an ecosystem where everyone's just competing against each other to grab the pharmacy owner's attention, when in order to really drive that innovation at scale, what we need to look at is how can we band some of these different innovations and tools together that have been built at speed, that have been built with the same safeguards and standards in place, that will actually be able to bring more solutions that change the way we practice to people a lot faster. And that's really the second point when it comes to speed, especially when we're talking about, the independent pharmacy, or we're talking about the community pharmacy, and the need for speed and the speed of change that we're seeing, and the need for different risks that we take, or to take that ownership. And maybe it's that investment into a delivery tool, whether it's an investment into a scheduler, whether it's investment into building up that digital awareness for your patients. But if all of these things are disparate at the end of the day, they're not created on the same standard, we're going to be hindered every step of the way. And that's really that greater idea of interoperability that needs to be put in place, I think, when we talk about these solutions that are coming out and feeding into other ecosystems that are already existing, like Prescribe It, which is an advancement, but it's a speed and those standards.
Thank you, Rui. Ashwin, Gurpreet, any thoughts to add to that?
Yeah, if I can, I mean, I agree with what you're saying. Sorry, Ashwin, if you don't mind. Okay. Ashwin and I have a relationship. As soon as I start talking, he just keeps quiet. I'm just joking. So I think it's, you're saying absolutely the right thing. I think, look, it's, the desire and the need to change will drive technology, right? And we need to drive all this technology, because only with good competition and with lots of development happening does good results happen, right? Like, you're not one person doing something rarely fixes the problem. It benefits this person, but everybody doing something. And the goal, as you said, Rui, is, so my notes here say, interoperability, what's our goal? And really our goal is patient care. right? Okay, that's bottom line. And so, like Rui said, let's develop stuff. Let's bring technology in, okay? As a matter of fact, let me make it present tense. Let's use technology that we have, right? And then it can sit on top of all the other EMRs, PMSs, whatever you want to sit on top of, right? Those things are not going to go away. And neither Rui, nor myself, no Oscar, no Paul, no Usher want to redesign Philware or Kroll or Acuro or, Oscar or anything. We don't do that. Let them carry on doing it, right? What we want to do is where we as pharmacists, we are the AI, right? We're always doing it, right? Without even knowing it, we're doing it. As soon as we see something, oh, John, you shouldn't be taking this medicine. It's going to cause a problem. You just know these things, right? That's an example of us being AI. We use this technology to sit on top of EMSs and PMSs, all those kind of things, right? We use our technology to sit on top of that. So let's continue to use the technology available to us, bring it into our pharmacies, bring it into our stores, and sit on top of the of existing platforms that we're using to bill our prescriptions, okay? To add on to that, once we start to, kind of see all these disparate pieces of technology available, right, to patients, right, there we will have to at some point say, listen, what's the best model who does this model suit best? Is it a patient-driven model or is it a professional-driven model, right? So are we developing technology to help the patients or to help the professionals? And if I may be bold to say, I think things like Prescribe It help the professionals and maybe not the patient. That's my humble opinion. When a patient's given a prescription by Prescribe It, it just goes, right? And then the patient comes to the pharmacy and I don't know what happened to it. Did I didn't get a fax? Because by the way, I'm still using faxes. No, but so that technology helps the professionals. I think we should be developing technology which helps the patient, right? When the technology helps the patient, it benefits everybody universally.
Agreed. Thank you. Thank you, Gurpreet. Ashwin, you had some thoughts to share?
Yeah, and maybe I'm sort of thinking out loud a little bit here, but I, hope it might spur some sort of further debate from amongst the panel. But sometimes I wonder if one of the barriers could be essentially, or one future barrier could be a large player, a large entrant actually trying to create like a walled garden. So walled garden, I think a lot of people know what this is, but this is, for example, the Apple ecosystem. A MacBook works best with an iPhone and an iWatch. You throw an Android into the mix, yeah, they kind of work, but they're not quite as well. But if you really want to extract the most value from it, you kind of adopt the whole stack. And so, when you have, for example, a MacBook, and you're in the market for a new phone, you might actually easily be cross-sold into an iPhone because of this interoperability. And so, if this happens, certainly there's room for that. But, at a certain point, does it stifle innovation? Because you have these large players, like, for example, even in Europe, so iPhones use the Lightning cable, which is completely different from USB-C, which is used for other cables. And the European Union basically just recently said, forget it, get rid of it. Everyone's on USB-C standard. And the onus is that it just creates waste of cables. So, you have basically a regulator coming in. And I almost wonder if there might be a role eventually for a regulator to be able to say that under the backdrop, less waste, but in this case, encouraging that competition and innovation. So I'm wondering if Rui, Oscar, Gurpreet, do you have any comments to that?
That's a very good question. And that has always been something that, I have always thought about and toyed with in terms of how much regulation is good enough and, whether regulation is a hindrance to innovation. That's always, the two sides of the story that we need to kind of, and currently right now, I mean, if I may say so, I know our current regulatory framework is not at all conducive to innovation. Like, we're very restricted in terms of what we are allowed to do. And, we had some comments here as well where, obviously our current framework, if anything, by providing virtual care, I think it was a huge step forward during the pandemic for pharmacy. But how long will that be sustained, and whether those regulations can, they have the possibility of being repealed as well if the demand is not there, or if the government does not have sufficient funding to support those. So that has always been a great, and I also wonder, is like, all this technology that's coming in, how are we regulating that technology? And I think that goes back again to the question of what evidence is good enough for a technology to then be considered and deemed safe and appropriate for a patient to utilize. And then, that's where my thoughts are right now on that.
I mean, I think, look, we're perhaps putting the cart before the horse here, right? What I think is we need to get to the point where we have enough technology out there to say this is too much, right? I'm a pragmatist in this kind of way. I think that we, if somebody said, well, you know what, I wouldn't mind actually. I wouldn't mind somebody regulating just to get rid of the fax machine, right? I'm not even joking, because I mean, this is the point I'm making. Like, we've already put the cart, like, well, what if we can't do that? Well, let's get there first, right?
Yes.
I think we've all dreamed about that scene in Office Space with the copier, but just with I think every pharmacist has had that fantasy.
Yeah.
A big field with a baseball bat and just slamming that fax machine.
The
whole fax machine industry is being kept up by pharmacists and physicians.
Staples only survives next to pharmacies. Like, every shop is talking about Staples. Done.
It's true. It's true.
Yeah.
I was going to reserve this question for last to kind of end on a lighthearted note, but I think I'll ask this now just to, hopefully get the audience laughing as well. But what are your thoughts? When do you think will be a fax-free pharmacy profession?
I mean, my thoughts, well, my hope is today, right? I mean, I've had this discussion with so many people, but seriously, because we're here in a professional environment, we need to be the change, right? Okay. So if we start to, all of us, eventually say, look, who makes the rules here? I asked the question, by the way, to some very connected people, because I don't care. I asked, so I sent emails and I sent messages, and I said, who makes the rules? And I got a document from somebody. I think it was made in 2012. Is this, and listen, there was a revision in 2015. Sorry, right? But I think, guys, give me a break. 2012. But none of us, we all talk about, none of us have challenged it, right?
Yes.
Every single person on this panel, every single participant in this discussion says, I know how to fix the problem. I can do it. I can e-transfer money. Why can't I e-transfer my prescription, right? So we've all had this discussion. We need to make that change. Let's regulate that. I'm not saying we go cowboy here. What I'm saying is, let's start to be part of the change, let's start to bring this technology in place. And then, yes, to Ashwin's point, we also don't want to be in a position where, one technology rules the roost. It cannot be that way. That's not good, right? But let's get going. Let's start. Let's all be part of the solution.
Agreed. Thank you, Gurpreet.
Yeah, there's so many kind of topics of consideration that have come up. I mean, I think about the Apple ecosystem, and it works because consumers love it. It gives them so much convenience. It gives them everything that they need. It's not that it's exclusionary of maybe advances or features that they really need to do but aren't able to do with it. And that's, I think, why it works and they're able to get away with what they do. But when we look at maybe the current tools that we're using in our pharmacies, and we look at, the bigger players that are currently kind of dominating that, what are they not able to do that we definitely need to do now in this new age in order to move forward? And can we look at whether that's okay, whether we need to take a stand against that, or do something different, because it's clearly maybe not meeting the needs of what pharmacies need in 2022. And then how can we push that forward is the biggest question, right? It's like, we want to axe the facts, we want to make these things, but as a profession, we're so used to referring to clinical guidelines and regulations to make our recommendations. That's what we've been taught. That's how we've been educated, that we look at those best practices and guidelines in order to inform our practice. And so where does that start then? In challenging the status quo. And there's questions here about pharmacy education and
Yes.
this new generation of pharmacists that are coming out. How then can we better structure the curriculum to enable this maybe different way of looking at challenging what's out there in order for us, for our profession to change?
Agreed. Thank you, Rui. Ashwin, I'll gather your thoughts on the axe the facts, and then we'll move on to the next question after that.
Sure. I don't know. I was enjoying both Gurpreet and Rui's comments, and it's funny. It's like, yeah, we sit back, and it came to my mind that we have to, as Gurpreet mentioned, we have to be the change we want to see eventually. And it's like, pharmacists are we our own, we're basically waiting for something to happen and or start to happen, and we have to be our own leading indicator at the pharmacy level and follow through with that. So I think, with the fax machine, unfortunately, we're not at that point where we're sort of driving the bus. And I think, I even think about just and when I say we, humanity, we're still burning coal for energy, and a lot of the targets for being carbon free are 2050. So I wonder if I should just peg my estimate to 2050 for the fax machine to get rid of it.
Being very conservative, I guess, but a realist too. Unfortunately, but I think this was great, and I think it's always, as you all rightly mentioned, like, this is something we all have a bone to pick with, but still, we sometimes, I often find it's not necessarily that pharmacists do not want to do something about the topic or the issue that is of a concern. It's more so they may not know how to go about it, to even start those conversations and those discussions, and have those actionable items generated that can result in that change. So maybe literacy at some point, advocacy literacy, digital health literacy also, like, there's social determinants of digital health now, just given the prominence and the way at which digital health is growing. There are social determinants of digital health, which includes patient literacy, but it also addresses healthcare provider literacy. And Rui, as you mentioned in your previous comment, in terms of how well are we preparing our future generations of pharmacists to be able to understand the various technologies and the way technology is even created. I think it's very important to know and learn that, so that you understand how the technology operates and how it can benefit you. And I think the course you have created, it's a great initiation into that, right? For all of us who are not in school anymore, this is a great way for us to learn and catch up on this topic. And I think there is another question which kind of is very similar to around that area is, with all the platforms that are currently available and that are in development, how will both patients and pharmacists navigate using so many different platforms that hold different pieces of information about the patient and the patient record? And I think that's a great question. And again, it kind of speaks to health literacy, digital literacy, but it also speaks to operability, interoperability, data sharing, etc. So I'd love to hear your thoughts on that. All three of you. We'll start off with Ashwin this time.
Yeah, and absolutely. And I think, we ultimately need unified platforms that are able to interface with whether it be scheduling or sort of a customer relationship or patient relationship management tool, in dispensary clinical support tools, things like that. So we really need these platform options that have that interoperability built in. It's no different from Windows or Mac OS or Chrome OS, bringing together everything in one spot so you can do both outbound and inbound functions. And so I think that's going to be a really important piece. And I think that's actually a very compelling business plan as well, to have that platform, because you can't really be it's hard to compete out of that when you're providing so many solutions at the same time.
Agreed. Thank you, Ashwin. Gurpreet, your thoughts?
Yeah, so if it's a couple of points here. So the current players in the market, I don't think many of them actually cater for the patient. I think most of the current players in the market cater for the professionals, the pharmacies, and the doctors, right? And that's nothing wrong. It's what had to happen because COVID happened, and we had to find solutions. And those solutions were designed to fix this kind of these short-term problems, but now we're growing with them, right? There's another point about, like, where do we go as far as a profession? Why can't we make the decisions together? Why are we so disjointed? Why are we so why aren't we as powerful in lobbying, for example, as the physicians are? I think we all know the answers. I think the question here is, where do we go? OPA, CPHA, OCP, where do we go? Who do we talk to, right? And so that's a big problem. That's maybe a debate for a different day, but that in itself is a big problem, right? Physicians are able to, get away with all kinds of issues with billing and remunerations and so on and so forth and blah, blah, blah. But, as pharmacists, we feel voiceless almost, right? And then we protect what we can protect, which is our little pharmacies, our independent stores. And we just stay there. And we say, it's okay if I have this little nest of mine, and because as soon as I start to take a risk, I'll lose my little nest also, right? And then, so to Ashwin's point and to the kind of overarching sentiment here, the tech available right now, it needs to work together. It can grow separately. It's fine, but we do have to have one place or one medium for it to work together, right? And I always use this example. When you log into online banking, right, you know exactly where the money is, where it went from, and how much money you have. You just know, and it's a given that when you log into your bank account, you know how much money's in there, or because it is. But I don't even know where my children's prescriptions are, because maybe they didn't get them all in my pharmacies, right? Right. And so this is putting now, every other sector has put the patient or the customer at the center, right? And then they take the information out of there, and then they take that data and they grow a little bit more, right? And TD Bank said, listen, we can close our branches because people are doing online banking right now. Okay, but TD Bank still, it's still there, right? I know pharmacies are independently owned and so on and so forth, but we put the patient at the center, right? The technology comes together to help the patient. I don't want to be the one developing every single aspect of the technology. In fact, I don't have to be.
Right.
There are great, schedulers out there. There's great, I don't know, all kinds of tools out there. Let's bring them together, right? And put them on a central platform, or make them work together, right? Different apps, right? Different apps talking together. Happens on our phone all the time, guys, without us even knowing, right?
Right. Great thought. Thank you, Gurpreet. And Rui, love to hear your thoughts on this.
I agree with all the points that have been made, and I have to say that this is already happening. Amazon just launched Amazon Care Clinic. They have pharmacies, they have providers of all shapes, sorts and sizes. They are already integrating the entire patient experience, and they have the size and capacity in order to do that. We see some of the billion-dollar companies that come out over the last decade, they're all focused on that consumer-first experience. And that's also how Amazon was able to have such a strong foothold, because the customer is king. At the end of the day, that customer experience has been the key to their success at the neglect of various other factors. But the customer at the end is happy because we can get our deliveries and get whatever we want within like 12, 24 hours, right? And I think in healthcare, that needs to also change. That the next huge company is very much going to be a consumer-focused healthcare company, and it just depends on who's going to do it and how that's going to impact the rest of the pharmacies out there, because if Amazon does it, they have their own pharmacies and they could just proliferate into their own way. And so how then are we going to set ourselves up to be able to compete with the likes of these players out there?
Absolutely. Something worth for us as a profession to really think about. Again, going back to
if I can just chime in,
yeah,
sorry to
absolutely,
do this, but Rue, to answer you, to comment to what you said, I think technology, right? It's in broad sense, it's the technology that we bring forward that's going to make us Amazon proof, right? We all know that there's just no way we can continue on this, come into my store and get your medication kind of situation anymore. It just cannot happen anymore, right? It's not a case of if, but when. So the technology that we bring forward, the technology we adopt and aggressively adopt it, aggressively bring it forward is what's going to make us Amazon proof, right? We have this discussion every day. Amazon's coming. I had a discussion with somebody yesterday who told me that Amazon's bringing drones. Do you hear about this? Drones.
yes.
Apparently they're speaking with the Canadian aviation people, and they got, the sky mapped up where the drones are going to be.
Wow.
It's very futuristic. This drone's going to drop off and kind of go to different houses like that. It's like a scene out of a Marvel movie, but it could happen, guys.
Hey, listen, they have those self-driving delivery cars now, which carry pizzas, I believe somewhere in Asia, where this is actually being currently trialed and piloted, where these cars are just driving themselves with pizzas being made to order.
Domino's is doing that. Domino's is already in that technology. They're doing that before having kitchen robots to make the pizzas. They're doing
bring them to Brampton and we'll tell them how not to do it, man. It's okay, man. We'll stop that technology in its tracks.
I'm from Brampton too, so I know exactly what you're saying, Gurpreet.
I just wanted to comment actually a little bit on this whole there's the customer first or the patient first, that idea that is being sort of championed by Amazon, and I think that's all well and good. And I mean, let's face it, the drug distribution aspect of pharmacy practice is completely scalable, and it should be scaled. It should be automated as much as possible. And that's that transactional model of what many individuals in public would expect or want. But I think what we also need to do is, with that in the background, think about market penetration of what pharmacists can do, going hand in hand with advancement of the profession, increasing scope to do more things and enabling technology. So I think that's where a lot of our difference is going to come from. Seriously, let's scale dispensing, get the robots to do it. They're going to do a better job anyways. And the things that we can do that nobody else can do, as well as us, we need to really lean into and use technology, smart algorithms to sort of get us 90% of the way there, and then use our own AI, as Gurpreet has mentioned earlier, to then, that's when we really demonstrate our value, and then that can support our professional and business model. So I think we have to keep that sort of in the background in terms of our automation and technological solutions, is sort of this idea of market penetration. We have our dispensing clientele, but they need to be our professional cognitive services clientele. And how do we really embrace technology to penetrate into that, into that part of the market?
I agree. I think it's kind of like, having unique pairings, which are harder to replicate with, repetitive tasks are very easy to, kind of be mass produced or mass managed, and does not necessarily require a lot of human resource. But when you have those cognitive skills paired with unique way of delivering, which is where technology can be very handy, it will allow us to kind of create our own niche, and not really be threatened by the next Amazon or next other multi-million or billion-dollar company that wishes to kind of take over the profession and dictate how we practice. I think that said, I have a quick, and this is again a question from the audience as well, but something that always, with technology, we're always worried about patient confidentiality.
Sorry, can I ask you just to hold that thought for 1 second,
Sure.
please? I want to comment on what Ashwin said, and in agreement with him. We're always scared of dispensing error, the physical dispensing error. We're ingrained that make sure that the dispensing itself, the medicine itself, and so on and so forth is correct. Like that seems to be, that's our cornerstone, right? We have to get that correct, right? And automate that, make it correct, but automate it, right? And then we tend to take care of that more at the behest of actually taking care of our patients, right? And so let's automate that, get out of the way, open yourself up to everything else that's available to you, right? Okay. And then the other thing is, we're always scared to increase revenue. Patients will never pay. They'll never pay. Oh, they'll never pay, right? Well, you know what? They will. Honestly, they will. And a personal experience, recently with a new service that we've launched, right? And very expensive service, right? And I really wasn't expecting it to go anywhere. I can tell you, it's amazing. And it's not a $10 service, it's not a $100 service, it's a $400 service, right? Wow. And I'm getting traction on it, right? And if I do 2 of those, that's 10 ODB prescriptions, man. Yes. Fees. And so the patients will pay, but I can't be dispensing at that time, right? Yes. That's technology, right? We forget that's also technology. Automate that. Bring yourself in, right? Yes. Talk to the patient, make an appointment. That's also technology, right? Absolutely. Have a video call. That's also technology, right?
Having pharmacy technicians in your pharmacy, they can take over the dispensing part for you. So you don't have to worry about a lot of your energy and time being spent on that either, right?
And then just to remind everybody, when we talk about technology, it's not some fanciful app on your phone. It doesn't need to be that, right? It can be something really simple like a robot. It can be something really simple like a scheduling tool. It can be something really simple like automated med checks, right? Those are the simple things that take you out of give you some free time, right? So.
Agreed. Thank you, Gurpreet, for sharing that. And I guess, what I was really going towards was around privacy and confidentiality with technology. That's always a concern, especially when we start sharing data. And, we did have some conversations around currently data is not accessible, but if the data does become accessible, what are some privacy concerns, I guess, that we need to be mindful of, and even for professionals and patients, how do you deal with privacy legislations when you're creating new technology? And maybe that's a question that I would like to go with.
I'm happy to kind of start on this. And when it comes to privacy legislation, there are, the legislative requirements that you have to fulfill that are kind of regulatory governance set in stone, right? And then those are still relatively vague and not very specific in what they force individuals to do. They're almost what we call kind of the bare minimum. If you meet this, you meet the bare minimum, and you can go on from that. And then on the other side, there is kind of what's best practice? What's best practice in the standards that you need to fill to be considered high security, highest privacy? And there are already a number of different standards like SOC 2, SOC 1 standards in place for healthcare that are already there for technology companies to follow. And that includes a number of different audits, number of technological tests to test the how secure your system is. Those are intensive annual evaluations that independent audit firms do. So there's a large spectrum when it comes to legislation and what's required. And then the other layer is in the implementation and in pharmacists' most digital privacy literacy or digital security literacy. And you have kind of provinces like Alberta with the PIA, where pharmacies have to create different standards and policies and how anyone who is touching data is going to manage it and safeguard it. And that's kind of a very comprehensive way, but generally for any pharmacy or any pharmacist to be able to develop protocols, really understand where are the areas that you have to be careful of, and also how to evaluate something as you're bringing it in to make sure that it fulfills kind of the bare minimum, also where they are in the best practice, and then how are you going to train your staff and to implement this and to implement it successfully. So there's many different levels to it, and there's resources and expectations for, I think, the first two. But when it comes to the last one, that's where we need, I guess, more best practices and support across the country in order to help pharmacists be able to leverage that. And hopefully the CE can be a start, but I'm also excited to hear what the other panelists have to say.
Thanks, Rui. Ashwin, I'll have your thoughts.
You know what, I don't know if I can I can add too much to what Rui mentioned. I mean, she just kind of hit it from top to bottom. So,
not a problem.
I don't
it's
know
always
if
good
I can
to have
add,
agreement.
I don't think I can honestly add too much value in that. It's not an area that I would say that I'm an expert in, and certainly I don't think I can add much to what Rui said.
No, not a problem. And thank you, Ashwin and Rui. And I think, I guess for Gurpreet, if you have any thoughts to add on this, would love to hear it. But also, as an owner yourself, what have been some considerations that you had to kind of look into before you, kind of had technology become part of your workflows? Like any insights you wish to share on that?
Yeah, first of all, I just like Ashwin, I agree with what Rui said. I mean, hey, listen, well answered, right? I mean, you hit the nail on the head there. So there's the whole legislation piece. There's the HIPAA and PAPITA, all those kind of things that we have to follow. That goes without saying. And then there's also I don't think that I would love to see more CE and education on this, because it's just going to become more and more and more necessary for our own personal development as owners and pharmacists, right? So perhaps we should move away from kind of old-fashioned learning to this, right? So good, we need to learn more. And then also to your point, very, very quickly, I know as an owner, when we implemented our technologies, we actually did have very early on in the days, we had some data breaches and so on and so forth, right? But thankfully on our tech, we consciously chose not to have any sensitive information, right? So we follow all the kind of Canadian laws. So our service sit in Manitoba somewhere, they have to be Canadian, etc., right? But you do as much as you can with the information and with the technology that you have available to you. And we're fortunate enough that data protection and privacy is so important right now that there are checks and measures in place for everybody, right? And so unless you're egregiously cowboyish with your data, we're in a good place, man, for it to be nice and secure.
Thank you, Gurpreet. And being mindful of time, I really do think this conversation can go on for the next few hours if we wanted to, but being very mindful of everyone's time, I did want to wrap this up at this point. And just one last question, Reid, you have designed this great course, and I think we're all in agreement that we need more of these courses. So Paul, we'll be keeping you busy with our requests for future. But at the same time, Reid, how else are we, growing awareness around this, just so that anyone who is not part of the webinar today or who may not be able to access the recording, how else can somebody find out about your course?
Absolutely. So we have some really awesome education partners with Pair Health Solutions, as well as our colleagues in Alberta in launching the course out to different areas. And so we'll be able to hit a variety of different audiences there. We also have our website as well, where if you kind of sign up to perhaps we can start a greater conversation and create a community. So we'll maybe link that all below, and also be accessible in that last slide I had in my presentation as well.
Thank you, Rui. And with that, thank you all of you, Ashwin, Rui, and Gurpreet. Such a great and wholesome conversation. And I'm sure we'll have many more of these conversations to keep the dialogue going. And Paul, I'll leave it back to you.
Good, great. Thank you so much, guys. What a tremendous conversation, and little things I picked up on. Gurpreet, we don't want to be cowboys. That was good. That's good. Anyway, lots of great and lively discussion, and thank you so much for everybody participating in this. Right. So I just wanted to a few things that I wanted to do first before we sign off. Number one. First of all, I wanted to again thank all of our donors and sponsors, right? You are making a difference, and just to our audience to let you know that we, the Canadian Foundation for Pharmacy, without our donors and without our sponsors, it's really tough to do these sorts of events like this. So all of your support is really, really appreciative. So please feel free to come to our website, and if you'd like to make a donation, we would be happy to accept that so we can do more of these types of programs. So I wanted to say that right away. I wanted to put a special on behalf of our board of directors who support all of these efforts on a volunteer basis and have for over 75 years. I want to thank all of them who have helped support all of the work that's going on today. And I also would like to, of course, I'd like to thank Rui, each one of our panelists, our moderators, for all of the great work that you guys have done.